Well, good morning, everybody. My name is Maarten Snoeijs. I'm one of the vascular surgeons in Maastricht. And we have a busy dialysis access center in Maastricht. And we would like to be welcoming all the participants of the NPath curriculum for the ReVac and the RePET courses. And here you can see a beautiful picture of the old center of Maastricht that you can be enjoying while taking these courses. Our dialysis access center is rather specialized. We have a center of excellence in vascular access surgery. And that means that we see a lot of referred cases from the entire country of the Netherlands. We have about 70 centers referring to our clinic, which is about 3/4 of the Netherlands, who refer their complex vascular access cases to our clinic. So we're used to seeing a lot of complications and difficult access cases, and I think that the participants of the NPath curriculum can benefit from that. We do a lot of duplex ultrasound examinations, about 800 per year. Obviously, we take care of our own dialysis unit, which has about 100 hemodialysis patients, which accumulates in about 60 vascular access surgeries a year. As you can see, the cases for referred patients are actually much larger than the number of local cases. So in our clinic, we do a lot of unusual and more extensive vascular access surgeries than I think people would normally see in their own clinics, because we get a lot of referrals from the country. We do about 175 endovascular interventions, and next to all these vascular access cases, we also have a peritoneal dialysis program where we do about 30 open surgical intervention, and actually laparoscopic surgical interventions a year for these patients. Our patients are satisfied with us. We get about 9 out of 10 satisfaction scores. So that always is for me an indication that we're doing a good job at our center. So here's just to give you an impression of some of the things that we're doing in Maastricht. At the left upper part, you can see endovascular treatment of a thoracic central vein obstruction for severe arm swelling. At the right upper panel, you can see an open surgery for a megafistula with huge aneurysms that we completely corrected and did a revision with distal inflow, quite complex, long surgeries. At the right lower panel, you can see that we started our endovascular fistula creation program using the ellipsis technique. So next to all kinds of complications that we try to solve for the country, we also want to be at the forefront of new innovations in the field. So the participants of the NPath curriculum will certainly be able to cover also the endovascular creation of fistulas in our clinic. And at the left lower part, you can see the laparoscopic PD catheter placement, which we also do in an advanced way with fixation of the catheter and omentopexy. So also these advanced laparoscopic surgical skills, we can expose our participants to these things while they are at our center. With regards to education, I think we have a long track record in Maastricht by organizing the yearly European Vascular Course, which has a specific section devoted to vascular access. You can see here in the times that we did on-site training, a surgical masterclass with a cadaver course with experts in the field educating young trainees in dissection of the vessels in the arm and creating anastomosis and fistulas and grafts in these in these arms. And at the right panel, you can see our central venous catheter insertion workshop, where we teach ultrasound cannulation, tunneling of catheters using models. Last year, due to the corona pandemic, we completely changed our schedule into an online training environment. So we have a lot of experience. We've gained a lot of experience with that as well. We did interactive video workshops with more than 100 participants. We even did online hands-on workshops where people were sent materials at their own house to be able to practice some basic surgical and endovascular skills, like vascular anastomosis creation and catheter insertion. Part of this access course has been also a peritoneal dialysis course, where we can use laparoscopy simulators, and we also had a live animal training at our animal facility, where we did laparoscopic peritoneal catheter placement in a pig model. So all these facilities are at your disposal in Maastricht. Next to the educational things, we also are very active in clinical research. We have a number of multi-center randomized controlled trials currently ongoing in the Netherlands, investigating the best vascular access for older hemodialysis patients, to make sure that with surveillance of the vascular access, we are doing a good job for our patients. And we are currently also in peritoneal dialysis access, doing a randomized trial on standard versus advanced laparoscopic catheter placement. So I think with all these activities going on in Maastricht, both on the clinical expertise, the educational part, and the research part, we are very happy to welcome all the nephrology residents who have entered the NPATH program for the REVAC and the REPAD course in vascular access and peritoneal dialysis in Maastricht in the Netherlands. Thank you for your attention.